Hi there, I'm Carol Blackman, and welcome to MagicATL.com, powered by Black Planet Radio. Today, I am speaking with Dr. Daniel Tesfaye. He is a neurology specialist at Dekalb Medical at Hillendale. Welcome, Dr. Tesfaye.
Thank you, Carol, for having me.
So, tell me about, for instance, headaches. What causes them? And are there certain things that cause them in one person that may not cause them in another?
Well, if we knew all the causes of headaches, we wouldn't be sitting here.
We wouldn't have them. We wouldn't have a headache ever,
That's right. There are different types of headaches.
Okay.
A headache is a very vast disorder. There are over 150 to 100 types of headaches, different types of headaches. So when we talk about headaches, not all headaches are the same.
Okay.
So we have to differentiate between what are the common types of headaches, or the one that really need to be seen by doctors.
Okay.
And there are the serious kind of headaches that we call them, that will need urgent intervention. So the most common type of headaches are what we call as tension type of headaches, where you get them but you don't need to see a doctor. At the end of the day, you're stressed out, you're tired, you have like a band-like sensation, or you don't, you have difficulties at work or difficulties at home. Stress related. These are the most common type of headaches.
Okay.
On the other hand, we have what we mostly see as the migraine and migraine type of headaches. Migraines are disorders, are neurological disorders that could happen at any age.
Okay.
But we usually see them in adolescents and young people, and also we can see them at any age. I mean, from kids to the elderly.
Wow.
So these are usually pounding, unilateral, throbbing headaches associated with nausea, vomiting, and pain is severe, and people usually lose, they could lose some work time, miss leisure time, and it could be quite incapacitating, and at times it requires urgent emergency room visits, but we really don't want them to go to emergency rooms for this type of headaches, but you need to take medications, and they usually last from 2 to 4 hours up to 72 hours. So this could be very disabling.
Yeah. Okay. So with the first type of headache, you said just kind of the common headache. Alleviating stress is just maybe one of the main ways we can start maybe...
Alleviating stress, and also...
is it diet? Is sometimes some things that we...
Diet is mainly with migraine headaches.
Okay.
Stress and sleep and are the major factors in tension type of headaches. Usually sleep conditions trigger this tension type of headaches, but stress is the major factor for tension type of headaches.
And then you said with migraines is what?
With migraines, it's complex.
Yeah.
What I usually tell my migraine patients is to keep a headache diary. By keeping a headache diary, you'll be able to identify the triggers, which means you don't know the cause of the headaches, but you can identify the triggers. It could be foods, in particular, it could be caffeine, it could be chocolates, it could be odors, it could be certain types of perfumes, it could be cheese, it could be ingredients in certain foods. Let's say some patients don't do well with Chinese food and wine and stuff like that. And there's also environmental factor.
Okay.
The barometric pressure clearly affects the incidence of migraine headaches, and there's a lot of factors for migraine. So keeping a headache diary usually helps to identify what triggered your headaches. But the most significant or the most alarming type of headache that we see is if somebody says this is the worst headache of their life, in their life, and it's like a thunderclap, like a headache.
Wow.
Then it could be very dangerous. There is a disorder that we describe as subarachnoid hemorrhage, which means bleeding in the brain, and this could be devastating and fatal. So this needs to be addressed.
Okay.
Or in migraineurs, or people who do have headaches, if their headache pattern changes, that's also needs treatment. Actually, anybody who has 2 to 3 headaches a week, who average about 2 to 3 headaches a week, and their headache is not resolving to usual medications, then they need to take what we call a preventative medications. But these medications do have a lot of side effects, so one has to be very careful in picking, and you don't have to take your friend's pills, you know.
Right, and folks do that. That's a
Yeah,
no-no.
that's a no-no.
Yeah.
You should go and see your physician, and if your physician wants, they usually refer you to a neurologist, or you can make an appointment with a neurologist. A lot of neurologists enjoy taking care of migraine patients.
Okay, so those were some of the, I was going to say to you, give us a few takeaways in letting us know what it is we need to do when we really, you know, need to go and see a neurologist and we're having headache pain, migraine or whatever. But like you said, if we're experiencing headaches 2 to 3 times a week.
And if you're missing work, if you're missing leisure time, if you're missing family time, you need treatment for those type of headaches. Because you may lose your job, or it could bring a little strain at home, you know.
Yeah.
If you go home and you explain to your partner that you are having headaches every time, then that may not be a good situation then.
Right. We need to go see a doctor. We need to
That's
call you
right.
there for sure,
That's
for certain. Before I let you go, Dekalb Medical at Hillendale actually got an award, the Award for Stroke Care, Georgia Coverdale Champion Hospital of the Year Award. Can you tell me a little bit about that?
Yes, we are extremely proud about this award. It's named after the late Senator Paul Caldwell, and he died from a massive stroke in 2000. And we are one of the 4 hospitals in Georgia that got this award. And you know, it's a concerted efforts of everybody of the hospital. It's not one doctor or one physician or one nurse or one physical, occupational or speech therapist. It's the effort of the whole hospital, starting from the management to the lower tier workers that got us this award, and we're very pleased about this award.
Well, congratulations.
Thank you,
And
Carol.
thank you for your time today. You didn't give me a headache. That's good.
Thank you, Carol.
Thank you, Dr. Daniel Tesfaye, and he's at Dekalb Medical at Hillendale. Really appreciate your time today.
Thank you.